Okay, let's see. I guess that was good. That was what I was trying to do, is like a supraspinatus tear. And I think some of the things that you kind of had me do were probably a little bit inappropriate for my
Just for the
condition.
pain.
Yeah.
Yeah.
So, for example, in
With
like
the
manual muscle
rotation.
testing, not actually
thought that
having
was
them
reasonable?
do it and seeing what they can do is okay. But like once you kind of get into like extreme like pain where it's like I'm limited there, you don't want to like manual muscle test something
Okay.
because technically if I can't get my arm all the way up there against gravity, I'm not even a 3 yet. Right?
Okay, right. You just want to get gravity minimized.
Yeah.
Okay.
So I could do it whenever I was gravity minimized, so I would be about a 2.
Okay.
But actually, you did say shoulder abduction, but you had me do flexion laying on my back.
Oh my god, I'm not
and then you had me come up and do flexion again, sitting.
Okay.
So I was kind of confused about that. I mean, it works, but not really, because it's almost like assessing the range of motion with my muscles, whereas this was like my passive, my range of motion on like passive structures and less like muscular based, if that makes sense.
Yeah, absolutely.
But I hope you kind of picked up on like the painful arc that trying to emulate with like painful, like kind of usually it's about like 60 to 120 degrees or so is typical pattern for like supraspinatus, where like you get to about here and you're like, oh yeah, that doesn't feel great, and then after that your deltoid kind of kicks in and takes over and helps move your arm a little bit better. But with that on top, what else do I have to say? Oh yeah, so like abduction, because I can't even do that, you're not going to want that manual muscle test that, because you already know I'm going to be less than a 3, because I can't, like, remember 3 is against gravity. You can do it. But because I can't do that because of the pain, then you can then move me into supine,
minimize, do the same test,
have me do it, and then you'd be like, okay, he's a 2, or maybe he's like a 2+ or something. But I wasn't able to do it against gravity, so that's why I also arm basically went straight down with the resistance. I was trying to emulate that as best as I could.
I see.
But let's see. For your subjective examination, you could have done more functional questioning.
Yeah, I thought that, like occupation, what do you do daily?
Yeah,
that
occupation, like work history, social history, how is home life, any issues that I'm kind of having at home right now. It could be anything from like washing my hair in the shower, like putting on clothes, putting on a jacket, even like bathroom habits, like all that stuff, like brushing my teeth, like just all those basic things, sweeping the house, chores, putting in dishwasher, washing dishes in general if that aggravates it. But yeah, anything that it's limiting for me from work. Am I working, or have I not been working? What else? I'm trying to think of what you did say and what you haven't said. But kind of along those lines, yeah, just getting a little bit more of a comprehensive. I'll send you actually the subjective exam sheet that I have, because it does like kind of list out a lot of those things, so it really helps you to hone in and follow those things.
Yeah, definitely.
Day pattern as well, of like, does it hurt really bad in the morning? Does it hurt really bad at night? That's always a good
I didn't even think of that.
Yeah, know in general, like how does it progress over the course of the day? You did ask me like my ags and eases, so like what makes it better, what makes it worse, but you didn't really specifically say like, okay, so what about over the course of the day? Because sometimes like with your patients, they don't know what makes it better, what makes it worse. It's very like, I haven't really thought about it. Like it just hurts and it gets irritating, but I haven't thought. And then when they come back in future visits, then they will be able to like tell you like, yeah, I actually noticed like, oh yeah, whenever I was like, you asked me about doing my hair, and I thought about it. I was like, oh, I've been like just using my left hand because my right, I don't want to pick up my right arm at all. And that's a good like functional goal for you to work towards.
Oh yeah, I see what you mean.
Because you can be like, patient will be able to wash their hair in the future, like in 5 weeks, with like 2 out of 10 pain instead of like 8 out of 10 pain, or like unable to do it at all. So there are those kind of things. You also could have got pain ratings. You didn't really ask me.
Yeah, 1 to 10.
Yeah, 1 to 10. Like, it's good to get like at time of visit.
Right.
At
I asked you how it
best.
was now. I should ask you 1 to 10 at least
Yeah,
right now.
at best, at worst. So like right now, I might have been like, oh, it's like a 5. Like, it's really achy. But then at worst, like whenever I'm like, I got my arm up at the end of the day, maybe I'm in an 8. And then maybe if I'm relaxing, sitting on the couch, I'm at a 0 or maybe a 1. Maybe I feel it, but like it's not an issue.
Mm-hmm.
Did you learn special testing for like super?
Yeah, I didn't even think of that. Full can, empty can. Yeah, absolutely.
So, full can, empty can.
Don't usually want to do that. Cause more impingement.
Yeah, it depends on who you kind of ask with that. It does cause more impingement, but then it also kind of like helps to push your idea. Like, well, if this does cause excessive impingement plus more pain, then you probably also have an impingement related factor on top of that, so you can know that in the future, like, okay, it's probably also an impingement thing, right? Because if I'm like this and I have like no pain and I do that and there is pain, it's probably not supraspinatus, it's probably an impingement. But if you painful, then there's a good chance that, you know, it is supraspinatus or it could be both. So it just helps to get you a better, you know, overarching view of your patient. There's also, I can't remember what this one's called, but I don't know if you guys learned this, where you kind of, also you can hear my shoulder popping like crazy. Wow, I don't like that. But you kind of push their arm down like that, and it's a test for impingement on the shoulder.
Yeah, we didn't learn that. That would make sense though.
Yeah, that's another one. There's a bunch of them that you can do. Those are like the 2 basic ones that I kind of know at the moment. But let's see.
Could have went through probably passive range of motion. I don't do a whole lot of that.
Yeah, I was gonna say hands-on, like passive range of motion would have been good to assess. You can also be stronger with your hands.
Okay.
Even with the overpressure. So for example, like, you know, maybe you have me do an active range of motion thing, and then you provide some overpressure, and you maybe take that that active like range of motion with passive, and then maybe you just have me, you know, lay down and say, okay, I'm just gonna move you around and just assess how things are feeling. And you can do it, of course, on my good side to start out.
Yeah.
And then, you know, move me into flexion, move me into abduction, move me into like some internal and external rotation. Just get a feel for how things are moving. Then come onto the right side and do the exact same thing. Like, if I'm fully supporting it in the flexion, is it fine? I was trying to like hint at it by just kind of letting it happen, but I wanted you to go, but I knew you probably weren't going to get around to feeling it on your own. Another big thing with that is making sure that like you literally like cradle their arm like it's a baby.
Okay.
Because if you're just like sitting there like with their arms like away from you and you're moving like this, they're going to be guarding a lot, probably increase the pain. Whereas if you kind of get really close onto them, have their arm kind of cradled in here, move it up, move it back, you can get a good assessment of how they're moving, and also if that is part of the issue, right? Because like, if you move me all up through flexion, through abduction, I have no issues, then you know that it's probably more of a contractile issue,
right?
As opposed to maybe like a passive structure, like a joint capsule issue. But yeah, so there's that. Is there anything else that I had to say?
I noticed. Oh, go ahead.
No,
I was gonna say for manual muscle testing, I did the affected side first, not the unaffected side first.
Yeah, you did do
for
that.
Goni, I don't know why. For Goni, I did the unaffected first, and then manual muscle test when it was actually really important, I did the affected side first. So
yeah,
I noticed I did that.
I saw that's just something dumb that, you know, you get used to doing. I mean, yeah, it's a little thing that you can note, but it's, you know, just getting used to like your lefts and your rights, and like making sure you do focus on the unaffected side as well as the affected side. It's just something that you kind of learn with the more reps that you get. I did want to say vital signs. I don't think that it's really, I don't know if they even talked to you about
they did. I wasn't sure what situation. I mean, obviously doing like every situation, but I wasn't sure if there's like a certain red flag that might cause me to do that. I don't know, maybe you said your heart was pounding or heart rate was elevated. I don't know, something like that. But
so that was actually going to get into my next point was systems review.
Mhm.
You didn't do like a full system. I don't know. You guys have learned like a systems review.
I think, yeah.
Yeah, like any
It's
issues
like
with like
integument.
vision, vision, balance, hearing, any issues with your mouth or your nose, any diagnosed circulatory issues, any
Yeah.
other like heart palpitations, any chest pain.